You're watching UNICEF television.
Driving through a rough terrain in the pitch dark, this ambulance is headed to Charch, a small village in the Indian state of Madhya Pradesh. There are no proper roads here, barely any electricity. But there is a 24/7 health centre with an ambulance service that provides transportation for pregnant women before and after delivery. For villagers from Charch who still don't have the luxury of drinking clean water or using basic sanitation facilities, this is a huge step forward in what seems like a long, desolate route to development. Until the centre was set up in 2010, they had to travel up to 40 kilometers to reach the closest health facility. Now, for the first time, villagers here have easy access to free medical services every minute of the day and every day of the year. Pancho Bai delivered her daughter at the Charch Health Centre last night, her first child to be born at a health facility.
Earlier, if we had a problem, we had to go to Pori town. We had to find a bus or hire a tractor. It was very difficult to find transport. It would cost us a lot of money to hire transport. It was very hard to travel if you were pregnant or traveling with children.
Distances can be dangerous, especially for pregnant women. Too many women and children in Madhya Pradesh lose their lives because they can't get help in time. Pregnancy remains one of the biggest killers of women, not just here, but in the rest of the country as well. One maternal death is reported every 10 minutes in India. And the Charch Health Centre is part of a larger initiative supported by the government and UNICEF that aims to reduce these needless deaths. With a fully equipped labour room and solar-powered lights, the Charch Health Centre has handled more than 650 deliveries in the past 2 years. Working round the clock, these nurses are skilled birth attendants and also trained in providing primary treatment for illnesses like diarrhea, malaria and pneumonia.
Not only this centre, we are setting up such centres across the state. We have 125 such centres in the state, and a lot of women from the marginalized groups are getting benefited by reaching these centres. So this is a very good step to address the issue of equity and make sure that we are reaching those who need us the most and take the quality services at their doorstep so that they have no constraint in getting these services.
It may be small and basic, but the Charch Health Centre has proven to be a lifeline for thousands, keeping women away from death's door and making sure childbirth doesn't turn into a time of mourning. In Madhya Pradesh, Priyanka Pruthi for UNICEF Television. For more information, go to unicef.org.
You've been watching UNICEF television.